Hello and welcome to Med Talks with Dr. Moin. Today we have an amazing person with us. Guess who? Dr. Anil Kaur. Dr. Anil Kaur is a consultant gynecologist at Care Hospitals, Nampally. Madam, welcome to our studio.
Thank you.
Ma'am, I know that you are a gynecologist and you have been doing a lot of great work in gynecology. How would you balance your life as a woman and gynecologist?
Surprisingly, you have asked an out of syllabus question, Dr. Moin. Okay, so it is very, very tough. Obstetricians are the most difficult in the medical profession because we have no timings. We have to be available 24/7. We have to be available 9 months of pregnancy. We have to be available 3 months post pregnancy. You can never switch off your phone. And being a woman, you have all your passions, all your family. You love to have your own children. You want to take care of your children. You love to cook for your husband. You love to give parties. And that is what life is all about. But an obstetrician's life is really, really tough. We have gone through very tough times.
So there are two branches, right?
Yes.
Obstetrics and gynecology. And here, like, we club these two branches together, right? They
Yes.
call gynops,
OBGYN. That's the degree we get, and we are trained in obstetrics that deals with childbirth, and gynecology, which deals with women's diseases away from childbirth. So that is all diseases of the.
Before I get into the detailing, I would like to ask one question. What is this obstetrics?
So obstetrics is the subject which deals with pregnancy and 9 months of pregnancy and the delivery. That is what obstetrics is all about.
Okay. And ma'am, like, would you be monitoring these people who are conceiving before? Do they come to you before they plan for pregnancy, or how would they come to you after they conceive?
Yeah, so 80% of the people would visit an obstetrician once they miss a period. And nowadays, because the strips are available, they would have confirmed a pregnancy. They would walk into an obstetrician's office. But that was not and the rest of the 20% who are a bit educated and all that, they like to come a little before they plan a pregnancy. So you see, in the 20 years, let me put it like that, lot of education has brought science into the fold for youngsters, even from the level of class 8. So they are studying about reproduction, about congenital diseases, about diet which affects pregnancy and all that. So the children, once they come to the marriageable age and they plan a marriage itself, they have a lot of questions. They'll come to the obstetrician to clear those doubts. And married couples, when they're planning a pregnancy, they would like to visit the obstetrician before they plan the pregnancy to see that they're conducive to a pregnancy, that they will most likely have a normal pregnancy and have normal children. Okay. So that is where the journey of a woman with an obstetrician starts.
Okay. And what do you recommend, ma'am? Like, somebody conceives, and how frequently do you advise them to visit you?
So there are a lot of protocols laid down by various associations, and the protocols are based on the economic situation of the patient by and large. Okay. But we have national programs, national recommendations, which will give you the timing of the visit. Mm-hmm. So supposing you are in a remote place and you're relatively normal, your visit to the obstetrician would be more spaced out. If you're in the city and you can afford it, your visits will be a little more frequent. But mandatory visits would be once to confirm a pregnancy, second to date a pregnancy, that is within 9 weeks. Okay. After that, the 5th month, where you assess whether the baby has a normal growth and everything, all organs are developing normally.
There are to check that.
Yeah, right? There are no congenital anomalies for the baby to carry through. It used to be 22 weeks, but by the order of the government last year, which was passed, act which was passed, now 24 weeks. Okay. After that, 27 weeks, that is the 7th month of pregnancy. And from there onwards, every 15 days, we monitor a pregnancy till she delivers.
Okay. And somebody has conceived. What are the do's and don'ts?
See, as a elderly obstetrician, I must tell the public that Childbirth is a normal part of a woman's life.
Right.
Please treat it as a normal part of your life. Don't call yourself a patient.
So you have to be as normal
As possible.
as possible. And since there are some physiological changes which would be happening while you are pregnant, you have to be little careful, right? And meet the doctor on right time and monitor yourself and monitor your
Yeah, so
baby.
that is why we have made the mandatory checkups, as I had mentioned it earlier. Those mandatory checkups are for your benefit as well as for the doctor's benefit, to know that everything is going on well. That you see, there will be some abnormal pregnancies, there will be some abnormal development of babies. So the obstetrician's duty is to pick it up as early as possible to give a solution to that,
Right.
and if possible to carry it forward till the 9th month, or also to advise a patient to terminate the pregnancy, that this pregnancy is not good, it has to be terminated. These are the decisions which an obstetrician takes. So that's why we recommend timely checkups, timely investigations, timely ultrasounds, and that's how we manage an obstetric patient. And now from the last few years, our slogan in our organization has been, no delivery should be done at home, and the delivery should be in a recognized place, and it should be a supervised delivery.
Okay.
Because about 30 years back, people were still delivering at homes, in farmhouses,
Right.
in a cow shed, maybe some on the road, in the jungles where the
Yeah.
tribals were living.
No, there were times when things were like inevitable. You are stuck in
So
between.
our aim is to give supervised obstetric care, supervised controlled delivery
By a specialized person.
Yes, by a qualified and trained person,
Right.
in the most hygienic and safest circumstances. That is the aim of the government. I think that was Vision 2030, but it has been extended a little bit.
Yeah, in the past times when you did not have all those facilities, when you could not reach the city, or when things were not available, probably you are helped by the so-called, the IMRs and all who used to help people and getting delivered at their residences. But right now, when you have these specialist hospitals, you have specialists, probably you should seek for a good help and have a very hygienic atmosphere when you deliver.
Yes.
And make sure that your baby is also monitored after being delivered, and few steps which you advise to take them, like a pediatrician should monitor, see and advise how to have a good health.
Yes, true. So our obstetrician's role is multifold.
Right.
Supervising a person, treating a person. As obstetricians, we come across diabetes, we come across hypertension, we come across obesity, we come across heart diseases. So we are trained in that. So as an obstetrician, I am a half physician and a half surgeon. So physician, because I have to carry the pregnancy of the girl through her 9 months, picking up any abnormalities and treating them, and as a surgeon, giving her a normal safe delivery, either by way of a normal delivery or by way of a cesarean section. So I have a dual speciality covered under obstetrics.
Yeah, when somebody can deliver normally, you will help them getting a normal delivery.
Correct.
Right?
Yes.
And when it is time, like you say, like this normal delivery cannot happen, then you advise them to go for cesarean section, right?
Yes. So
Madam, coming to this cesarean section, nowadays we see that many people are going through the cesarean sections. What is the numbers? Do you have any numbers, like ratio, like 1:2, 2, 3, 4, 7, 8 from normal deliveries to
yeah,
cesarean?
actually the statistics keep changing, and I won't quote statistics because I didn't revise them and come. But yes, the cesarean rate in the last few years has gone up, and specialist bodies have analyzed it.
Okay.
It is multifactorial, but at the end of the day, the obstetrician, the onus on the obstetrician is to have a normal baby and a normal mother. Okay. So all the indication for an cesarean section depends on that. That's the only common factor. We want a normal healthy mother, and we want to have a normal healthy baby.
Okay. Now in this process, we have heard about a term. They used to call it cord around the neck. and this is the indication you should go for a cesarean. What is that, madam? Cord around the neck?
Yeah, so the baby has a very long umbilical cord which is attached from the baby's umbilicus to the placenta. It is a supply channel of nutrition from the mother to the child.
Okay.
Now it's a long cord, it may sometimes run into 2 feet also, and the baby, when it rotates inside the mother's womb, which has lot of fluid in it called amniotic fluid, sometimes this cord gets entangled. Sometimes it may get entangled in the foot of the baby, the hand of the baby, or sometimes it may go around the neck of the baby. So what happens is, it is surprising to see that sometimes 2 loops, what the baby would have been doing inside, we don't know. Dancing, jumping, parachuting, we don't know. But the cord goes around the neck and it may become tight at the time of delivery. That prevents it from getting, it's like strangulating the baby. But we have also seen cases where the cord has gone down 4 times, but it has not affected the baby in any way. So as you talked about the indication of cord around the neck, yes, it used to be a dreadful situation to find ourselves into, but nowadays we have a test called the Doppler. So we monitor the baby with the Doppler all throughout the pregnancy and a CTG, which takes takes reading of the heart of the baby. If even with the cord around the neck it is not affecting the baby in any way, we may still think that depending on other conditions, but if it is affecting the heart of the baby, then it's indication for urgent cesarean section.
And you do a cesarean section and the patient, the mother, gets discharged after how many days? 2, 3, 4, 5, how many days?
As old timers, we used to keep the patient in the hospital till sutures were removed. But because suture materials have removed, anesthesia has improved, and general health of the mothers is much, much better now in the last 10 years. 3rd day, we discharge the patient on the 3rd day. Once she is able to get up from the bed and walk, once she has passed a stool, once she is able to eat or drink something, we send them home.
After the mother is discharged, do you advise her to do some exercises?
We recuperate the body structure, the body figure, to regain the muscle tone which has become flabby at the time of delivery, but only after 6 weeks.
Only after 6 weeks, not before that.
Yeah, so 6 weeks is what we call the postnatal period. In those 6 weeks, the nature itself makes the body recover. So you have to give the body that much time to recover. And only after 6 weeks, we can expose the body to exercise to recover what has not been recovered by nature.
And what about lactation, ma'am? Nowadays, I see that many mothers, they are not able to feed their babies with adequate milk, which never used to happen in the previous days. So what is the reason and how to overcome that situation?
No, lactation problems were always there. They were always there. There would be some mothers who would never produce a drop of milk also. But in between, there came a fashion when the mothers had milk, but they didn't want to feed the babies because they thought it would spoil their figure. Education of the girls in college and going to be mothers in the antenatal period, that has changed a lot, because lactation is the best source of food for the baby, and we encourage them. Now we have specialists in hospitals who come and teach the mothers on how to breastfeed the baby. So it has become a different field itself. And yes, now educated girls, they are all going to breastfeeding. You would have seen campaigns in some airline offices where they have given separate rooms for lactating mothers to sit and feed the baby.
And nowadays I have seen
that. And after that came campaigns where the mother is sitting in the lobby or the lounge and still she is breastfeeding and nobody will say anything to her. So lactation, the concept of lactation has changed a lot, gone back to ancient times, because lactation and breastfeeding is the best for the baby.
And ma'am, after somebody delivers a baby, what is the recommended time period you advise next pregnancy?
We advise 3 years minimum.
3 years?
Yes.
I remember my grandfather, my grandmother had a child every year.
Every year. Yeah, there are still patients who have children every year because they don't come for family planning advice. So, lot of changes in society depend on what the government campaigns are. You would have seen government campaigns on tubectomies and vasectomies going full strength about 25, 30 years back, and then they leveled out.
Okay.
So then you saw a jump in the population of the country. Again, we are going back to the same thing. We are promoting, see, the knowledge which is there has to reach the last person.
Right.
If a person is staying in the city, not making themselves available to a hospital or a doctor, how will they get family planning advice? Earlier, government used to put out visuals,
Right.
boards, TV, radio, but all that has stopped.
Right.
So now we have to go back to that and educate you see, the population and gynecologist ratio is huge. One gynecologist cannot educate so many people, so the government has to step forward and see that the proper spacing is done for the health of the mother and the health of the baby.
Okay. So it is advisable that you wait for 3 years so that the mother's health becomes 100%. She recuperates.
Yes.
And the child is also capable of taking
Yes.
care of himself or herself.
Correct.
So that is the advisable time period. And now, ma'am, like I just heard that once you undergo cesarean, you will always go for cesarean for the next second or third time. Is it true?
No, it's not true.
Okay.
But for giving a VBAC, as it called, vaginal delivery after cesarean section,
Okay.
that is called a VBAC, you have to have a good setup,
Okay.
a trained doctor, a confident doctor,
Okay.
then they can have a normal delivery also. Depending on the indication for cesarean. So that rule is hazy. It's not a rule, but most of the people tend to follow it because they don't want complications. That's the thing.
Okay. And ma'am, what is the age, the right childbearing age for a woman?
So the government of India has elevated it in the last 2 months only, from 18 years to 21 years. Yes. So that's ideal as far as the physical growth of the girl is concerned. That is the right decision of the government, because at 21 she is mature, her bones are mature, her organs are mature, her mental status is mature, she can handle a baby, she can handle a pregnancy. That is when she can start childbearing, and she has a long childbearing period. You see, she gets menopause only at the age of around 40 or even later, but till 35 she can have children.
Right.
So 21 to 35 is a long period to have any number of children you want.
Right.
So we should discourage them from getting married early or having children early.
And the cutoff period, if somebody is not having children or somebody has children but wants to have more children, what is the cutoff age? Like, is there anything?
So till 35, as an obstetrician, if a girl came to be pregnant, I wouldn't worry. She will have a normal pregnancy. She will not have any comorbidities, as we say, hypertension, diabetes, etc. So she is a normal person. After the age of 35, two things happen. Some other morbidities set in for the girls. And the other thing is that after the age of 35, the ovulation reduces, so chances of getting pregnant reduce. So we encourage them between 21 and 35 to finish their childbearing.
During this cesarean section, people are talking about painless, delivery. People are talking about this new term called epidural anesthesia. Normal delivery. Does this epidural anesthesia helps, and do you recommend it?
Again, epidural anesthesia is a boon for the mother because she has a painless delivery, as you said. Absolutely no pains. It requires hours of monitoring. It requires hours of an anesthetist sitting with the patient, and it prolongs labor a little bit. We don't do it routinely, but in some hospitals it is a routine. Some doctors do not do a delivery without an epidural, but some of us wait to see if the patient is able to tolerate labor. I, as an old timer, would like a mother to also have some labor pains.
Okay.
So labor pains is a part of beautiful childbirth.
Okay.
So the rest of her life she
you
can.
You call it beautiful, ma'am?
Yes. So rest
Men
of the.
standing outside the theatre, they are like scary. Oh my God, what's happening to my better half?
So not till that stage, then you can always step in with an epidural. But I love that dialogue mothers gave, I bore so much pain to deliver you. So how are they going to repeat that dialogue then?
It's an amazing thing. Like, it's a natural thing, basically. God has given this, to go through this for every living organism, right? Ma'am, one thing I would like to ask you. Nowadays, I just see that many young girls, they are coming across puberty at an early age, why is it happening? Is it something related to the diet, or is it related to, their tradition, what they are going through, or is it related to some milk or something, buffalo's milk or cow milk? They say that they are being given some hormones like oxytocin. What is your experience?
Yes, so early puberty, which we say before 9 years, is an abnormality. Okay, you have to investigate for internal hormonal problems for various organs.
Okay.
But from 9 years to 11 years is premature puberty, which is being seen in a lot of people. So maybe the definition of puberty in future might change. Yes, the younger age group puberty is related to a very healthy lifestyle.
Okay.
Second thing, the environment. You see, the youngsters start getting those hormonal inputs from the environment by way of movies, by way of books, by way of like media. And yes, it is a stimulant for the young girls to go into an early puberty. Diet, environment are the two major things which have brought the puberty, bringing the puberty age a little lower now.
And what do you advise, ma'am, for people, for young girls who doesn't attain puberty till a later age?
Yeah, so earlier we used to wait till about 16 years. This is, I'm talking about 30 years back.
Okay.
Now 14 years, if they don't attain puberty, and the family history suggests that everybody else in the family has attained puberty by that age, then we start investigating the girl.
So by 14, if somebody doesn't get puberty, they should consult an endocrinologist or a gynecologist?
They can consult an gynecologist first.
Okay.
They will do the initial screening.
Okay.
And only if an endocrine problem is found, then they can be referred to an endocrinologist. Most of the time, a delayed puberty is a big subject to discuss. And sometimes there are simple solutions for it, and sometimes there are no solutions for it.
Nowadays, we are coming across so many women coming with a common term called PCOD, polycystic ovarian cyst disease.
Yeah.
What is that, ma'am, and why is it happening?
So PCOS is basically, if I want to give the lay public a definition for PCOD, that means you're not ovulating.
Okay.
Okay. Every girl who has attained puberty and become mature in her puberty levels should ovulate every month from an alternate ovary for the rest of her life till she attains menopause.
Okay.
Now PCOD is polycystic ovarian disease, and we also call it polycystic ovarian syndrome if it's related to obesity and other metabolic disorders. But basically it is an ovulation. That means the girl is not ovulating. Without ovulation, she is having a period. That requires a lot of help, treatment. More than help and treatment, it settles down by itself. It requires a lot of reassurance by the doctor. So it takes a lot for the gynecologist to help the mother and the daughter understand that she will get over it. It is not a dangerous sign for her. And most of the time we'll treat when she's planning to get married.
Last question before we wind up this. I would like to ask you, what tips would you give for women who are in their 40s? What gynec tips would you like to give to have a healthy life?
So at the age of 40, if they have not already attained menopause, we are entering the age of menopause, where your hormone levels come down. So hormone levels support lot of tissues in the body besides the reproductive organs. So what I would suggest to a girl who is at the age of 40, start getting your screening done. You have to screen yourself for your vitamin D levels, B12 levels, get a screening done for your uterus and ovaries by way of ultrasound, get a pap smear done, and get a breast ultrasound done to see that you're not harboring any breast problems.
I just forgot to ask you about this thing you mentioned, pap smear. And what is this pap smear and how frequently it should be done, and for what age group of people?
So from the reproductive age group, we start doing pap smears.
Okay.
We don't do it for unmarried girls, or let me put it like this, for not sexually active women, we don't do a pap smear. We start doing a pap smear for sexually active women at the age, whatever age they come to you. If it's a normal smear, we do it every 3 years.
Okay.
And if it's not a normal smear, we call them frequently 6 months to 1 year and treat them.
Okay.
Again, that's a very big topic. But the pap smear basically picks up abnormal cells from the cervix and the vagina.
Okay.
The reason being that cervical cancer is the second most common cancer in our country or in the world. So we do, that's a screening. That's a screening for cancer.
Yeah. And ma'am, there is a vaccine to prevent your loved ones available,
So that's
right?
an HPV vaccine. Over the years, they have found that harboring an HPV infection leads to cancer over a period of 15 years. Okay, it takes 15 years for a human papilloma virus to convert the tissues of the cervix into cancerous tissues.
Okay.
So we have a long window period,
Okay.
and now they have a vaccine to prevent it. But even after taking the vaccine, we do recommend pap smears because there are so many strains of HPV. The vaccine covers only 4 strains, and there may be other strains which may be causing cancer. So pap smears are mandatory for women.
And what is the ideal age where they should start taking vaccines?
Vaccine is now recommended by pediatricians. We start giving them before they become sexually active.
Right.
By the age of 9, we have started recommending HPV vaccine. Let them complete the 3 doses before they become sexually active.
Right.
And then boosters have not yet come into the market because the life is studied of the vaccine is, I think, about 12 years now. 15-year study is not yet over. Once the 15-year study is over, then they may recommend a age for the booster also.
Okay. So right now the recommendations are like 3 shots they should
Yes.
receive within what duration, ma'am?
0, 1 and 6 months.
0, 1
And 6 months.
and 6 months.
Yes.
Thank you so much, ma'am. This was a wonderful sharing of information to our people through you. Before we wind up, I would like to have a round of rapid fire questions
Sure.
with you. Madam, what is the best source of calcium?
We recommend milk, rice, natural sources.
Okay. Which milk, cow or buffalo?
Anyone.
Anyone.
Yeah. Depends on which Baba is recommending what.
Oh my God. We don't have Patanjali milk nowadays.
I won't recommend it.
You won't recommend it. And ma'am, what is the ideal age for childbearing?
As I told you, after 21 years.
People exercise during pregnancy.
100%. Their recommended exercises up till term. Of course, different kind of exercises they can exercise.
What are the important tests during these 3 trimesters?
So the important tests are the blood grouping,
Okay.
viral screening to see that they're not carrying any hepatitis or HIV. Syphilis used to be screened for earlier. We have almost stopped it now. The other random blood sugar, thyroid test, and urine examination. These are the mandatory tests for the first visit of pregnancy.
Okay. Finally, lactation. Is there any relation between lactation and garlic?
Not that I found it, though there are other, that's a good point, Dr. Moin. The thing is, there are herbal products which are recommended for lactation
Okay.
because Ayurveda has a lot of herbs which are not commonly what we eat. They are different herbs, Shatavari, Shatkari, something like that. They have formulations and they do help in improving lactation. But it's a hit and try method. It's not guaranteed that. Another medicine which we have in our pharmacopoeia is Perinom. Perinom is a very good drug to improve lactation, and we have tried it in many patients and it definitely helps.
It doesn't have any side effects.
Except for a little bit of drowsiness which may be there for the mother, which some of them have, some of them don't. But it has to be started early. Supposing a woman comes to you 1 month after a delivery, says, and she doesn't have milk, give me some medicine, nothing is going to work. It's only in the first 3 or 4 days when you realize that there is no lactation, you put her on these medication, she may start lactating.
That was really wonderful, ma'am. Thank you so much, ma'am, for spending your valuable time for our viewers. And we will catch you again for more details about gynecology in our next video. Thank you so much, ma'am. Thank you so much for spending your time, and stay tuned to our channel Mozoomin on YouTube. Thank you. Welcome to Med Talks with Dr. Moin.